Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. I'm tickled to death that you joined us today. We're going to talk about the #1 killer of beef cattle in the United States, bovine respiratory disease. And we're going to talk about how to treat cattle with bovine respiratory disease with Dr. Mike Apley from right here at Kansas State University. Stay tuned.
Closed captioning brought to you by Kansas Soybean Commission, the Soybean Checkoff Progress, powered by Kansas farmers. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Well, Mike, welcome to the show.
Thanks.
Folks, this is Dr. Mike Apley. He's a friend and colleague here at Kansas State University's College of Veterinary Medicine. You know, we've done some things on the road with our Cowboy College and do a lot of work directly with feedlots, directly with our veterinarians and our vet students. And BRD is one of those things that has kind of been one of the things we've worked with a lot.
Main staple, yeah.
Yeah, so we talk about bovine respiratory disease in beef cattle. You know, the big thing that the first thing we have to do is identify sick cattle out in the pen. And what are some of the things that you kind of coach on for picking up one that's not doing right?
Well, one of the things I encourage people to do is, we need a protocol anymore. I think the days of not having written plans are really behind us, and it makes some people squirm, but it forces us to plan and really think about it. And I encourage people to write down what they're looking for, especially for training the next generation or new help. And they may even use a scoring system. Sometimes we use a 0 to 4, where 0's, hey, there's nothing wrong with this calf. 4 is it can't get up, and then we might argue a little bit about 1, 2, or 3 in the middle. But that's a training tool, because by arguing about how ill the animal really is or depressed, that forces us to talk about what we're seeing and then train and interchange about that. So we call it a case definition in veterinary medicine about which ones we'll actually treat, and it shouldn't be all of them in a pen situation. Obviously, we're going to unless we're applying treatment for control on arrival or something, but we're going in to pick out certain animals. And let's talk about the criteria that we're going to do: depression, how they move, and then we'll have secondary criteria when we get to the chute, and that includes maybe temperature or listening to them or a variety of different things. But that's our main, those two things put together.
And so when we talk about out in the pen, let's do our primary and then let's go through our secondary. But let's get out in the pen. The old DART protocol is pretty hard to beat. But what are some of the things that you're having cowboys, pen riders, farmer feeders look for in identifying a calf that's sick?
Sometimes you got to adjust your dial on the way those cattle are behaving. Mm-hmm. Ones that are a little wilder might not allow you to see the illness as quick or as much, and so you have to be a little more tuned into them. Basically, depression, hanging out from the others, it really draws my eye when I go up to a group of calves and everyone moves away except 1 or 2, or some are slower. So really heavily on depression, how well they're eating. I'll sure let a sunken flank make me look over a calf, but I won't let a full belly talk me out of pulling one if I think they're really sick. Respiration rate, depends on the time of the day, as all our listeners would know, and how you evaluate that. But it's one that really stands out as different from the others. And the way they present to you may change in the way they do that as they become more used to you and more comfortable with you and are not viewing you as a predator or a threat to them. So really standing out from others is one way.
Yeah, we're going to take a break, but the big thing, is cattle are kind of like people. You have people that have a hangnail and they miss work for 2 weeks, and you got people that come to work every day with Ebola virus and blood coming out of their eyes, and cattle that get sick some of them you can identify real easy, and some of them blend in and won't let their guard down. But when we come back, we're going to talk more with Dr. Apley about bovine respiratory disease, how to pick out those cattle, and how to treat them.
Next time you see a beautiful field of corn, reach out and thank the farmers who work tirelessly to raise corn. for livestock feed, renewable fuels, and exports to feed a growing world population. The farmers on the Kansas Corn Commission work for Kansas Corn with grower-funded checkoff dollars that support foreign and domestic market development, research, promotion, and education to expand opportunities for Kansas farmers. To learn more, visit kscorn.com. Buying a car shouldn't be this hard. And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal. See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome.
DocTalk, brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. We're back with one of our regular guests, Dr. Mike Apley, and we're always tickled to death to have him break free from his busy schedule to come talk to us. Generally, it's about antibiotics or feedlot operations, and every once in a while we might let you talk about a pig, but not
today.
Not today. Today we're going to talk about bovine respiratory disease, and we've got the calf, found the sick one out in the pen, and now we've got them to shoot. And you have a secondary criteria that the doctors or cattle feeders are going to look at, and let's go through those.
Well, and I'd say we found one in the pen might be sick, and
Right.
that's the attitude we want to have to come in. Now, some places will say if they come out of the pen they're going to get treated. I prefer to apply some secondary criteria, and we can use temperature, rectal temperature, and one of the things to do is make sure you got a decent thermometer that's actually reading right. And sometimes we use water baths along with a calibrated thermometer, which may be beyond some of our producers watching to do that. But a good, high-quality thermometer. Invest in a good thermometer.
And our normal rectal temp is 1015 to 1035 in these feeder cattle.
Most of the time, and of course, hot afternoon, it's going to be higher. And but I usually use at least a 1035 to 104 cutoff.
Yep.
And there's going to be some exceptions to that, but if we just make a lot of exceptions, sometimes we end up treating a bunch that don't need to be treated. Another way that people are looking at is listening to the lungs and seeing.
Yeah, when you said it earlier, we're going to listen to the cattle, I was like,
Listen to them talk to them.
hear those little voices.
That's only late at night. It's called auscultation, but listening to their lungs and seeing if there's some sounds there that would direct us one way or the other with them. So there's some secondary criteria to apply in the chute, and you put that together with the fact they came out of the pen, and now you make the decision to treat or not treat.
Right. And sometimes you can adjust, I see some veterinarians adjust their treatment protocol based on primary and secondary criteria. I just, if one's sick, I have pretty much a criteria that this is what they're going to get, just trying to simplify things. But once you've made that decision, we've looked in the pen, we've identified the sick calves, we've brought them up, we've confirmed that the pole was running a high fever and the lungs don't sound very, we don't have good lung sounds. We've got to make a choice on an antibiotic. Mm-hmm. And we've got about a minute until we go to the break. So if we need to, we can go into the next segment and talk about this as well. But when it gets down to antibiotics, what are some of the big things you're thinking about?
I'm thinking about probably giving it to them just once. And then the big thing that's in my mind when I give an antibiotic is, when am I going to decide whether this animal's responded or not? After I've given this antibiotic, what's the period I'm going to allow for recovery? And then I'll have a plan for yes, no on that. But that's the main thing in my brain.
All right. So, I've read your myths. So, is there any good combination of antibiotics?
No.
Right.
I just give one. Yeah.
Just give one antibiotic and give it at the higher dose once rather than the lower doses consecutive days.
And then I go for the antibiotics that are single administration, which is the majority of them we have now for respiratory disease.
Well, we're going to have to pick this up.
I
Let's
think
take
so.
a break and we'll come back. We're going to come back. We're going to talk a little bit more about antibiotics, and then we'll jump into some of the ancillary therapies, which might be an even shorter conversation with the good Dr. Apley. Thanks for joining us. See you here in a minute.
The BQA Tip of the Day, sponsored by Boehringer Ingelheim Vetmedica Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA Tip of the Day, we're going to talk about lung scoring cattle and the newest tool we have available to us today to use to help us better identify the severity of respiratory disease in cattle is a stethoscope. For the last 50 years, the only two ways we've pulled and treated sick cattle is by visual observation, as well as then once they're in the chute is using a thermometer to see what their temperature was. Up until a few years ago, we have never had a tool such as this to give us another tool to our toolbox to help us better identify the animal and the severity of the disease that they may have. It's very easy, works very well. You place the stethoscope right here, it records the lung sound, kicks it across to the computer, kicks out a lung score, as you can see up here, and then we can use that as part of our decision-making process and antibiotic selection for these sick animals. It's a great resource. It's the best thing we've had since a thermometer. Let's put it to use.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Now another gardening tip with Annette Jackson.
Fall is a great time to plant trees, shrubs, and perennials. Root development this fall means more growth with less watering next year. For faster root growth, always use Fertilome Root Stimulator. It is the only stimulator which contains IBA rooting hormone. Use Fertilome tree and shrub food after the plant has been planted for a month.
Save 25% now on Jackson's homegrown hardy perennials. Let Jackson's friendly staff help you select the best plants for your landscape.
Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
To see this show and past episodes of Ag AM in Kansas, go online to agaminkansas.com. DocTalk, brought to you by the Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Mike Apley, who is a veterinarian who specializes in feedlot medicine. He specializes in clinical pharmacology. And Mike, I'm just going to bullet list some things.
Okay, we can do that.
The first one is you know, I've heard people want to use combination therapies, 2 antibiotics versus 1. If 1's good, 3's better. And what's your thoughts?
2 issues with that. Well, several, actually more than 2. One is, you know, can we justify the added cost and the added injection sites, et cetera? 2 is there anything at least publicly available I can access which would suggest that this improves response to therapy, and there just isn't. So I know we can increase costs, we can complicate things. I don't have evidence that increases efficacy. And the 4th is, if you pick the wrong combination, you can inactivate some of those. So for example, the beta-lactams, which include penicillins like penicillin G, cephalosporins like ceftiofur, which we have 3 versions of. Those work with the cell wall dividing. So the cell wall has to be clicking along and dividing. So for example, when we have strep throat, those things are dividing every 20 minutes, so they're having to build new cell walls, and those are like slipping a fake brick in there, and they get built and they just crumble, so they die. But if you put in a drug that slows down the growth, like a tetracycline, then those can't work as well because it isn't growing as fast. So sometimes putting 2 things together isn't.
Yeah, and you've even shown me some of the papers in some of the pediatric pneumonia cases where we have decreased treatment response when we use combinations versus using the drugs individually.
Yeah, and you avoid all that by picking one drug. And the other thing is thinking you have to put something with it to get quicker action, and that's just not true either. So many of these things are peak concentration by 3 to 6 hours, and when it's a 6-hour peak concentration by 3, it's really close to it because it's a big gradual arc. So,
how about IV versus sub-Q? Intravenous injection, vein in it?
Vein in it.
Get it in there quick.
Yeah, anymore, that's kind of more for show. I think our drugs we have today, even though they're single injection, they get to a pretty rapid concentration gradient. They get pretty quick.
So, and then the other one is single versus multiple treatments of an antibiotic.
I really like the single injection ones.
And the example is given, let's just use Baytril as an example, 1 big dose of Baytril, the 6 ml per 100 one day versus 3 cc's per 100 3 days in a row.
Right. And we learned something years ago, and back then it was the long-acting oxytetracycline against daily injections. And so they'd get a total of 9 milligrams per pound once with the single injection of the long-acting over 3 days, or they got 5 milligrams per pound every day for 3 days. So they got a total of 15 split up daily, and the 9 milligrams once beat the 15 given it every day. And part of that's just quit messing with them, give them the single injection.
I always say, if you have which one would you rather have? Go into the doctor's office 3 days in a row for a treatment, or get 1 dose? We got to take a break. When we come back, we're going to wrap up with BRD with Dr. Mike Apley. We're going to talk about ancillary therapy and some of the things on recovery. You're watching DocTalk, and we're sure glad you joined us.
Hello, I'm Dr. Frank Lyons from Kansas Regenerative Medicine Center here in Manhattan, Kansas. Daryl was one of our patients that we did about 7 months ago.
I dug trees by hand for years and years and years. In the process, I wore out my rotator cuff. But when I learned about this process, I thought if there's a way to get rid of this pain, then I want to do it. So we did it, and it worked. And I'm not going to go out and dig trees with a shovel anymore, but I can do the things that I want to do now.
Well, it's been very gratifying to help people with their painful joints and other entities. And it's been especially gratifying to be able to help people who I know and have worked with and known for many years.
Here's another gardening tip with Annette Jackson from Jackson's Greenhouse.
Fall is a great time to plant perennials, trees, shrubs, and bulbs. Root development occurs with the moist and cool soil conditions, which means better growth next year with less watering and maintenance. The use of mulch on all plantings helps protect from freezing, thawing, and drying out. Let Jackson's help with your next planting.
Jackson's top quality fall bulbs for spring blooming have arrived. Always plant the best bulbs for bigger, better blooms.
Jackson's Greenhouse has what you need today.
Heinen Brothers, a 4th-generation Northeast Kansas farm family, knows how tough farming can be. Farmers helping farmers. Heinen Brothers Ag, selling and servicing crop protection products, fertilizer, anhydrous ammonia, cover crops, quality aerial and ground application. Call today to learn about our extended term financing program. 800-760-4964. HeinenBrothersAg.com.
Healthy cows start with the new hired hand automatic livestock sprayer, Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Kansas Farm Bureau, the voice of agriculture, represents grassroots agriculture. The state's largest and most powerful farm organization stands up for its members through leadership development, agriculture education, legal defense, environmental advocacy, farm safety, and risk management. Members also enjoy money-saving benefits. To join our organization today or to learn more, go to www.kfb.org or find us on Facebook and Twitter.
Tallgrass Commodities offers producers bulk commodities at a reasonable price with reliable service throughout the whole Midwest. To find out more about Tallgrass Commodities, visit tallgrass.us or call 785-494-8484.
Kansas Farm Bureau, the voice of agriculture. To join today or for more information, go to kfb.org or find us on Facebook and Twitter.
Hey folks, welcome back to DocTalk. Dr. Mike Apley here at Kansas State University's College of Veterinary Medicine, talking about BRD treatment. And we kind of hammered on work with your veterinarian, identify cattle early, set up criteria on when you're going to treat them, one antibiotic, single dose, sub-Q, and then we get to the question, what else do we give them?
Time.
Time's a good answer.
But that did remind me of one thing,
Okay.
The post-treatment interval, when you give that
Okay.
single injection,
Yep.
you've really got to have a plan for how long it's going to be until you say, are they better or do they need another treatment? And the data's starting to look like that week to 10 days is pretty much the magical spot.
And that's what, when I was in practice and still do some consulting, our treatment interval from first treatment to an animal that is going to need a second one is 11 to 14 days on average. And that's looking at millions of cattle, And so when you're looking at that 7 to 10, even regardless of a 48-hour, the ones I treat day 1, day 3, day 5, I don't buy a big bag of feed for those.
No. Yeah.
Those are checking out.
You can tell where they are, yeah.
So good treatment interval,
yeah,
7 to 10 days, depending on the types of drugs of when we're going to reevaluate, but do it consistently.
Yeah. So back to your original question.
Yeah. What else are we going to use?
And I still struggle for any evidence. Every year, we talk about thinking about this fall and what's going to happen. I'm still struggling for evidence that putting anything with that antibiotic helps us in long-term recovery and getting that calf back to being a productive animal.
And so we're talking about B vitamins, and folks, we're talking about, when we say ancillary therapy, we're going to give the calf an antibiotic, but we're also maybe going to treat him with something else at that point in time. And I'm with you. I haven't seen anything yet that says that treating with, whether it's B vitamins, IBR vaccination, vitamin C, banamine or flunixin megalamine, what else? Dexamethasone.
Yeah, dexamethasone especially. I think there's pretty clear evidence we can do some harm with that one. Definitely some harm besides just not making an outcome difference. And
because of the immunosuppressive actions.
Yeah. And as a matter of fact, dexamethasone in cattle is used as a research model to shut down their white cell function. So,
well, I think the big thing is, and we've got to wrap up, but closing comments, BRD.
It's pretty straightforward. Case definition, do it consistently so you can have some records you can evaluate, pick one antibiotic, get with it.
Work with your vet.
Yeah.
Well, thanks for being here.
You bet.
It's always great to have Dr. Mike Apley from Kansas State University's College of Veterinary Medicine. And thank you for watching DocTalk. Remember, always work with your local veterinarian. And if you want to find out more about what we do at K-State, you can find us on the web at www.vet.ksu.edu. Thanks for watching DocTalk. I appreciate all that you do, and I'll see you down the road.
Closed captioning brought to you by Kansas Soybean Commission. The Soybean Checkoff, Progress, powered by Kansas farmers. To see this show and past episodes of Ag AM in Kansas, go online to agaminkansas.com.